Now, a report presented today by community-led monitoring system Rachidze shows significant improvement in systems in KwaZulu-Natal's clinics and hospitals. The report presented to the province's health department details among the improvements shorter waiting times and friendlier staff. For more information on that report, we are joined by the project coordinator Ndivhuwo Rambau. Ndivhuwo, thank you so much for your time here on eNCA. What else did you find? I mean, this for a lot of South Africans is quite a surprise. You're talking about the public health sector.
Yes, we are talking about the public health sector. As Rachidze, we monitor close to 126 facilities in KwaZulu-Natal, and this is the third edition of this report that we are launching. And when we look at the data compared to when we started monitoring when we released the first edition of the report in 2021, we are finding that KwaZulu-Natal is doing quite well in a number of indicators that we monitor in Rachidze. First one being especially on waiting times. Like waiting times have reduced in KwaZulu-Natal, where we have public health care users, waiting for, 2 hours, 18 minutes for them to be seen by public health care facilities. And we find that across all of the provinces that we monitor in South Africa, KwaZulu-Natal did quite well when it came to the staffing and, waiting times indicator. And this also included issues around staff attitude, where over 82% of public health care users felt that staff in the clinics that we monitor were friendly and professional.
Yeah. So talk to me about the LGBTQI plus community. Any improvements there? I mean, KZN is a mostly rural province, and obviously there's a lot of concern when it comes to provinces like that. Any improvement when it comes to LGBTQI plus?
Unfortunately, for key populations, it's a dire situation. We have got reports of key populations, including sex workers, trans people, gay, bisexual, and men who have sex with other men, as well as people who use drugs, indicating that they've been turned away from the facility and not be able to access any services. On top of that, when we look at, HIV prevention services, when we did our observations in the facilities, lubricants could only be found at 26% of sites available. So that tells you that, there is challenges, especially for key populations in accessing services in the province. Though PrEP was also reported to be available at all of the sites that we monitored, it is hardly prioritized or offered to key populations, and that's a very good tool to increase HIV and prevent HIV as well. And in terms of the actual key population specific services, it's very difficult for KPs to access those services. When we speak to trans people, very few reported that facilities respected the pronouns that as a trans person you would want to be referred to. At times you are still assigned a file that is in a color that is not the identity or gender identity that you are identifying as. And trans people also indicated that there's very little knowledge around issues of hormone therapy. So these kind of things can cause, gender dysphoria as a trans person. People who use drugs also reported being, humiliated in some instances when trying to access services that, you've come to steal. Everybody, pack up your bags, make sure that you take care of your belongings. And at times, people who use drugs indicated that, I'm just going in, I just need a service. I might have a wound. Actually, I just want to access my treatment because I also want to, adhere and take my treatment properly.
Did you, add the factor of load shedding in your report? Because sometimes that could also add to delays at hospitals.
Yeah. Yes, for the previous 3 quarters, I believe we've been monitoring on issues of load shedding under infrastructure, and load shedding definitely does add delays in facilities, not just in KZN, but across the province. across the country, we found the same thing. We found that at 33% of sites, staff cannot work because they cannot find files in dog filing rooms. And it's also a struggle for data capturers to be able to do their work as well, which means that they become backlogs, or people need to be turned back and they have to go back home and come back the next day. Only 56% of facilities that we monitor had a functional generator that actually works and has fuel. So amongst the recommendations, we say, let's put generators in the facilities to ensure that services don't stop because there's no electricity for the clinic to actually move and operate and give services.
All right. Thank you so much for speaking to us about this. Hopefully, it'll improve even further. I mean, people being able to access ARVs for 3 months. And also, 2 hours, 18 minutes in a queue is still quite a long time, but a huge improvement from 2 hours, 39 minutes. Ndivhuwo Rambau is the project coordinator at Rambau.